Many of my clients suffer with circulation issues or nerve pinches that cause pain down into the hands, and it's often confused as carpal tunnel syndrome, but frequently what we find is that it's actually a tight glenoid socket. That's your shoulder. And when this socket is tight, it has a lot of blood vessels and nerves that flow through it, and we need to loosen it up. And unfortunately, stretching your pec muscles or your rhomboids is not the solution. You need a lateral stretch. So I'm going to show you how to do that. Before we get into stretching the glenoid socket, you have to stretch the muscles around it in order to get the separation you need to stretch the interior muscles. The first thing we're going to do is a pectoral stretch. You're going to put your elbow on the wall, even with your shoulder, and just step forward and lean. And that creates a line of tension across that pec muscle that you hold for 30 seconds. When that's done, you're going to find a doorknob or a pole or whatever you can grab to put weight on. And you're going to grab that and create a line across the back of tension between your wing bone, your scapula, and the spine. You're stretching those muscles, supraspinatus, infraspinatus, and those muscles are holding that shoulder in place, and then come up to neutral. And you're going to have a pretty loose shoulder socket that you can then transition into a glenoid stretch. First, you plant your foot at shoulder length, and then you use that to stabilize yourself. Then you grab whatever you want, a pole, a doorknob, and lean into your leg. And then relax your shoulder. And as you relax that shoulder, you'll feel it pull on the socket, and that's your goal. In 30 seconds of that, we'll take all the little teeny tiny muscles in there and stretch them out so that they relax. And then you just come up and then return your arm to a neutral position, and that's it for the stretch, but it's important that you take the full 30 seconds. All right, next I'm going to show you how to coach someone else, and this is what you would see if you came in to see me in my practice. So KT, I need you to just go ahead and rest your hand on this doorknob here, and then put your foot directly below your shoulder there. And what's important is balance here. We don't want you to fall over. So what you're going to do is you're going to lean out and put weight on your knee. Yeah, that's fine. Whatever's comfortable for you. Everybody's body is different. So the point is to stretch this shoulder. So the only muscle that you flex is your hand. This needs to be relaxed. This, more importantly, needs to be relaxed. And as the therapist, I can actually reach in here and feel the separation in the shoulder while she's doing it. And then she holds that for the full 30 seconds. And it's important to breathe just like she is when you're doing this. And that helps the muscles to relax and to elongate. And then when you're done, you can go ahead and stand back up.
I'm feeling it loosen.
All right, and then return your arm to the neutral position. And now as a therapist, I can then touch inside of the glenoid socket and tell a distinct difference in here.